Hi, Mr. Blumdahl here, welcoming you to your frog dissection. I'm sure you're all very thrilled. Some of you wildlife students did this back in 7th grade, but we'll reintroduce you back to the frog here. Right now we're looking at the dorsal side of the frog. If we flip it over here, we've got the belly or the ventral side of it. And we'll start with some of the external parts. If we flip it back onto its dorsal side and turn it around this way, one of the first things that you'll notice is the tympanum right there, or the tympanic membrane it's sometimes called. Those are going to act like its ears, and it's going to sense through there, or sense vibrations through there. Eyes are going to be right here, of course, and unique thing about the eyes, they have a nictitating membrane that's covering them. And I've already peeled through this one. And if you get inside that membrane and peel it back, it's kind of like a pair of goggles that the frog can wear. You'll find the actual eyeball, and I have that right down here, as you can see at the bottom of the screen. Takes a little work to pluck that thing out of there, and sometimes it'll sail right across the room, so make sure you've got your safety glasses on. But it's kind of fun to pry that thing out of there. Looks kind of cool once you get it out. The nares, if we get in nice and close, those would be like the nostrils. They're going to be located right in there. I've opened up the mouth of this frog so that we can, if I flip it over here, get on the inside and look at some of those structures. The tongue, as you can see right next to my thumb, unique thing about it, it attaches to the very front of the mouth. And then it kind of slings it out the other way when it grabs onto something. So you can see right there where it's going to be attached. And when you do your dissection, you can actually go in there with a scalpel and cut that part right out. The teeth. Frog has two different rows of teeth. You can see a couple of them right in here. Those are going to be your vomerine teeth. It'll use that just to hold its prey in place. And it eventually will swallow it whole. Then you have the maxillary teeth that are going to run along the outside. Nothing that's going to be sharp, just for holding on. You could stick your finger right in the frog's mouth. It's certainly not going to hurt. Also, you'll find eustachian tubes. They're going to be way at the back. If I pin this mouth open here, I should be able to get a better look at them. The eustachian tubes are going to run right from here on either side back to the tympanum. Just like you have those within your ears, connecting your throat and your ears, and it's going to allow for some fluid to run through there and deal with balance a little bit. All of the important sensory parts that a frog has are going to be in the head region right here, so that the frog can sit within the water with just a few different things above the water and still be able to see, hear, smell, sense the environment that way. And even catch prey with that tongue. Now in just a moment I'm going to open up the frog so that we can have a look at some of the internal parts. I'll be back with you shortly.